So welcome back to Everyone Loves My Mother. Today, though, we are talking about a slightly more controversial subject.
I ripped my hand and they had been cutting my finger off. And there was blood pouring out. And then I remember 10, 9, 8, boom. I honestly couldn't believe you were my baby. And I wasn't able to walk for days. The whole thing went horribly wrong. Yeah.
Check your FSH, check your AMH. First maternal instinct was like, Jesus, she's ugly. Fertility is a poignant subject, both you and I. Delicate, but one we wanted to discuss. And actually one of the reasons I wanted to do a podcast, actually.
It was. It's one of the reasons you want to do many things. Fertility is an absolute passion.
It's a passion.
Of yours.
It's a passion. And I will just prefix this episode by saying it is controversial. And my view is not everyone's views.
No, we're not medically trained.
We're definitely not experts.
Definitely not.
Not medically trained. And I totally appreciate that I've gone to really quite wild lengths within my own fertility journey. Hate the word journey, but that's what it was and is. And we're just here to really talk about that, and I suppose be open about that. And I'm glad we actually do live at a different time, that I think we as women are more open about our fertility, but miscarriages and the lengths we go through to have our children sometimes are not as discussed as I think they should be.
Sometimes one could have considered them taboo.
Yeah, I mean, you're a bit older, Mum. What was it a bit more taboo?
I don't think people talked about it as much. No, definitely they didn't. I don't think it probably wasn't taboo, but it wasn't discussed, and there weren't as many options as there are now.
Tell me about the beginning of your
my
wonderful
fertility
journey.
Yeah, my fertility journey has actually been very easy. I've had one miscarriage, which I believe 25% of women have. So I'm very well within the realms of normality there. 1 in 4. I found getting pregnant very easy.
Fertile myrtle.
But I sympathize hugely with people who don't. I feel very, very lucky. I've had some interesting births.
How many children have you got?
I've got 4 children. You are my eldest child.
You do usually talk about what you're wearing. Maybe this is
Oh,
not,
yes.
maybe it's
Gosh,
not
forgot about
frivolous
that.
to-
So sorry.
Forgot. Alice,
Just
what
part
are you
of the
wearing?
podcast, you
Alice,
see.
what are you wearing today?
So sorry.
No.
Annie, get your gun.
I am wearing a Veste shirt.
Love that.
Always fan favourite with the, what's that, like a...
Gingham, rick-rack.
A rick-rack. A gingham shirt with a rick-rack. With
Trim on the collar.
beloved beige...
Now, where's that belt from?
Well,
Where is that
people
belt
can't
from?
see, Mum, so it's from Gucci. And I'm wearing, I just found in my pocket, I think these are called Palazzo Flare
By frame.
by Frame.
My-
They're not the ones you wear.
I wear slim palazzos.
Okay, well, they're not slim, mine.
Well, that's scary that I'm wearing the slim ones. I'm not wearing slim today.
And I'm wearing my favourite cowboy boots, which are by Paris, Texas. Now, how many items are you wearing?
Well, we could start with my Ryan Simkhai Logan glasses, which everyone asked me about. Ryan, I don't know why I haven't heard from you, but they do. And you should. And it shouldn't be called Logan, it should be called Serena. But anyway, moving on. I am then wearing, I think this shirt is probably 20 years old, maybe more. And it's Tory Burch. Shows how her good quality clothes last a lifetime. And it's called the De Neuve blouse.
Fabulous.
And I have it in a cotton voile. I've got several of them. So if you see me wearing another one in the next half hour, I've got more than one. An old ME+EM cashmere polo neck, black. Moving on, I've got my ME+EM gold cuff.
We don't need to go into jewellery, Mum.
Well, people ask.
Okay.
You'd be amazed. And then once again, I am wearing some frame jeans. They're not the slim palette. I can't believe they're not slim, because why would you not wear slim? Why would I wear slim and you not wear slim? These are called mellow or wellow or slim and something or other. And the shoes you gave me for Christmas, Roger Vivier leopard flats. There you have it.
There
in a
you
big
have
nutshell.
it.
Big nutshell.
I hope you enjoyed that. We're going to have to feedback you and say what you're wearing has to be under 30 seconds.
It's not.
And
Why
if you've
would it have to be under 30 seconds? I could go on about it a bit longer now.
I don't think people are that
I
interested.
can't remember the name of these jeans. Someone look them up. They're black, they're thin, they're slim and something or other.
That's you in a nutshell. Okay, so tell me. So you had an easy journey.
I
We're
did.
talking fertility. So how was the ride with me?
Well,
how did that go?
You were born in Switzerland.
Yeah, not that interesting to people, but
Well,
carry
you
on.
were. Well, we're telling a story. It's a journey. I was married to your father at the time, very briefly, very, very briefly. Once again, we're always hoping he's not on Instagram.
This
And-
isn't Instagram, this is a podcast.
Same thing. on the World Wide Web. Hi, Pama. Anyway, so yes, I had you. You were 4 days late. I was convinced you were going to be a boy. We were going to call you Tom. And I went into labor, and all of a sudden, I think that my obstetrician actually had a golf game, and on Easter Sunday. So I had an emergency C-section under general anesthetic. Now, this is going to go on long. So do you think they're going to cut it? Shall I continue?
Continue.
Anyway, I'd read all these books, but
Tom's here to basically say this is boring.
Okay, I'd read all these books
This
called...
is about fertility.
Yeah, and remember, there wasn't internet in those days. It was in the olden days.
God, you're old.
And so I'd read this book called What to Expect When You're Expecting, and the book I'd read was in English. Anyway, so I'm in the delivery room. Yes, what, Tom?
It was in English.
The book was in English.
you
but
read other books
I was
in other
I was in a
languages?
Swiss hospital
So
where
you
they spoke
read other
French.
books in French?
No, but I'm just pointing it out. I'd read an English book.
Not an Australian.
It becomes relevant. Anyway, I'm lying on this table in the delivery room, and in those days they gave me a general anesthetic, and they put my arms out to the side. That's going to be difficult, my two new shoulders, but I'll pretend. There we go. For those not watching, I've just put my arms out to the side. I put my arms out to the side. They try to tie this green sheet in front of my face to get ready for the surgery. And they're trying to fiddle with all this fabric over my hand, and they can't quite get the tie to tie onto the metal frame. And all of a sudden, I'm in labor, so I'm having contractions, but all of a sudden this pain is unbearable in my finger. And I'm like, I've read this book. There is nothing about pain in a finger when you give birth. I cannot stand the pain any longer at all. I rip my hand out of this Velcro where my hand had been tied to the frame, and they had been cutting my finger off. And they've been doing that because none of you were listening, doing that because the fabric didn't reach the frame, and it was an emergency. So they were like, oh my God, we've just got to cut it. And there was blood pouring out. And then I remember 10, 9, 8, boom. And I woke up. And had I been in America, I'd have, sued the hospital and be living the right old life of Riley on a ship right now. But and I'd sued the hospital for everything. But I woke up with a bandage on my hand, and it was terrible. I actually did need a blood transfusion, but it couldn't have been from my finger.
May I just
can we go back
remind
to
you that this is
fertility?
meant to be about fertility?
But you asked me about the birth.
Okay, so then what happened?
So then I had you, and then I saw you in that cradle, and I was surprised. I was surprised because A, you're a girl. B, you were not a beautiful girl. And I looked and I thought, Jesus Christ, whose baby is this? I honestly couldn't believe you were my baby. And I wasn't able to walk for days because I had the blood trial, and the whole thing went horribly wrong.
Serena, that's quite mean.
It's not
She
even.
was adorable,
they say
ginger.
beauty in the cradle, ugly in the cradle, beautiful at the table, and that's what we've got. But anyway, my point being that I'd push you around. I was there for 10 days. In those days, Alice, we were in hospital for 10 days with a C-section in Switzerland. Probably suited my husband to get me out of the house. And no one would look in and say, what a pretty baby. They'd just walk on.
That must have really upset you.
It did.
It's interesting that that's your first maternal instinct was like, Jesus, she's ugly.
I was just surprised you had red hair. In fact, I will find a photograph and they can put it, not the show notes, but they'll flip it up on the screen. So for those of you not watching right now.
And people wonder why I'm as tough as I am. I mean, listening to your...
No, don't be ridiculous. And then what about your first birth? I was there.
Well, but quickly, just tell me about your other births.
Oh, you're interested. Okay. So then,
Well, I mean, let's not go as detailed as that, because that was quite long. We've only got 40 minutes. But I mean...
the second one I had induced birth with now.
Vaginally.
Don't use that word.
We are using that word. We're talking about births.
Okay, that way. As they say, the front door rather than the sunroof.
Not the back door.
You don't have babies out of the back door, Alice. Alice, we've talked about this before. You don't have them out of the back.
No babies come out of the back door.
Now, this is
Obviously.
very interesting for people, though, because a
bit?
lot of people, not about having a baby out of the back door, a lot of people want to have a vaginal delivery after a C-section.
Yes, and because 8 years, was it 8?
Nearly 9 years had passed. And
They-
that is why Mum was able to do it. And the other reason, just so you, again,
Very brave.
I am no expert, but it's something I get asked a lot because I had so many C-sections. The other thing is you had gone into labour. So if you'd gone into labour, I'm sure every
I didn't know
obstetrician
that.
listening to me is going to be like, Alice, you don't know what you're talking about. But your body knew to go
If you
into...
think any obstetricians are going to be listening to this podcast, you are deeply mistaken. Once again, hi, Mum. I mean, It's like just having a show for my mother.
Anyway, if you want to try a vaginal birth, if you've gone into labour first, it is a better idea coming from
Well, I
Dr.
can't-
Dawson. It's
obviously I
true.
can't.
I've never gone into labour.
I know.
So my obstetrician said, Alice, the likelihood of you ever going into labour early enough is very unlikely because you've never gone into it once.
All I can tell you is what they do is when they start fumbling around underneath the delivery bed, you know you're in trouble. And you know when you have a barbecue and you have those sort of things like that, pick up the meat tongs, they get them out there. Oh no, not that size. We'll go for the slightly bigger size. Anyway, I had a forceps birth.
Wow.
And they pull the bed. Yeah. Let me tell you, I couldn't sit down at my 6-week checkup.
Wow. I remember you had you had B nearly in a lift.
And then B, I had a natural birth, completely no pain relief, because she came early and that was pretty strong. I then had Eleanor beautifully arranged. Blow dry beforehand. In you go, full enema, everything out.
You had a colonic before you gave
colonic,
birth.
everything. I was
This is interesting.
absolutely.
I think there's a whole birthing episode. Who knew my mother had enemas?
Oh yeah, I was just completely scented candles. Bought my own bed linen. Obviously I was very, very fortunate to be seeing a wonderful doctor who I was probably.
Did you fall in love with him?
No, he was called Mr. Kenny, Anthony Kenny, and
Is he alive?
I don't keep in touch with him because I don't need to have a baby anymore.
Well,
But
who knows?
And that was it. So I very much controlled my last. I was very much out of control with my first and third. But yeah, no, that's my journey. But I was very lucky on many fronts. And you.
And me. Is that
Over
how
to
you're
you.
going to ask me a question?
So tell me, I was.
You're going to have to brush up on your kind of interviewing skills.
Sorry, yeah.
She's used to being the star.
I know. It is about you.
She's used to being the star.
It is about you. That's
Sad
not
but
forget.
true. So anyway, Alice, I was at your first child's birth.
When he actually came out.
I was there, yes. Because we were allowed 3 of us in the room.
Yeah, I mean, I want to try not bore you on my delivery details.
Or should we move on to the second one?
My birthing details. So I had, all my babies were C-sections.
Mm-hmm.
They progressively, the C-sections got worse and
They did.
worse. And I would say get a second opinion if you need to have a first
Completely.
C-section.
I think there was a
'Cause
golf game involved in that.
I was 26 years old.
Genuinely, he was a very nice man. I remember he had a moustache. He actually went to Lord's to watch the cricket.
Not okay.
He went early to watch the cricket. So I think
Anyway, at 26 years old, I had a C-section because my eldest was breech, but I think he even did turn.
I think, yeah, it suited him.
It suited the doctor.
suited
And the problem is when you've had one cesarean,
Exactly. It was very sad.
you've got to have more. So then cesarean 2.
Wait, I was going to...
Yeah.
Do you remember... I mean, I having had you, and I wasn't that well, but you really were not well after his birth.
Yeah, well, it got worse. But then cesarean 2, Tom was then in the room.
Mm-hmm.
This was Nancy.
I was in the room the first time.
Yeah, just. Nancy had been given to me, which was amazing, and a wonderful moment. But Tom was looking quite
Grey.
grey. And little did I know my womb was actually out of my body at this point.
With Nancy?
Yeah, because
Oh,
it
yes.
had been, there was a tear in it. So they had to burn it back together. And I'll never forget the smell of the burning of that organ. Anyway, the womb went back in. Nancy was there. That was all brilliant. Do ask any questions if you're interested, Mum. And then
Well, I was there, so why would I? Oh, let me think. Did you find a difference between the two births, Billy's and Nancy's?
I had a really nice cup of tea after Nancy's and it made a huge
I
difference.
do remember. Do you remember Tom after Billy's when they said, "Would you like a celebration dinner?"
He ordered grouse or something
Grouse.
in the room.
No,
I
no.
nearly
You did,
lost it.
Tom. You did.
I just had lunch.
You had like pigeon or grouse, and I just
Guinea
given
fowl.
birth. Guinea fowl, there you go.
Same thing.
And then number 3, then things got a bit tiny bit hairier. So I, having had 2 C-sections,
Yeah.
they were all nervous and they were like, "Oh, the womb came out last time."
And we switched doctors. You had a new doctor now.
No, new doctor for 2 and 3.
Exactly.
And it all went really well. And we were in the room, and I was
Thought,
holding.
this is easy? Yeah.
Holding Felix. We thought easy, easy, easy. And then sadly, I then started hemorrhaging, and basically my womb had collapsed.
And they had to put they called it a balloon?
Well, then
Umbrella.
and then I never forget, I had to give you Felix. Do you
Yeah.
remember? And you were just holding Felix on your own in the room.
Yeah.
And I went
And your
back
parents came. Tom's parents came.
Yeah, it was quite embarrassing, bleeding in front of them. Anyway, I then went back in surgery. They put a balloon in my womb so it could contract. Hope I'm not boring you all. And we waited. I was in recovery for kind of 5 or 6 days, I think. to get me back.
Yeah, you didn't go to the room for quite some time. You were very, very unwell. And that's when we realized.
The more C-sections I had, the worse it got. And then sadly, after that third C-section, because it had gone so horribly wrong, developed an internal hematoma as big as my wrist. And that had to be taken out as though I'd had nearly a whole other C-section. So
So you had to go back to hospital.
I had to go back in. But you know, it is funny that you just forget it all. And that's what I
Nature
find
is
so
very
interesting. You never remember it. You never think of the pain. You know, it is just, I think actually it's more painful for the men. Like, I know, sorry, that is going to really explode as a comment.
Yeah,
but I
I
mean,
think
the
that's-
memories are more painful for the man.
A lot of men suffer greatly seeing their wives go through the trauma of birth.
Yeah, it is
They do.
much more physically painful for a woman. But what I just mean is, I think you do have these endorphins that just erase the memories of it all. I think that segues well into perhaps talking about IVF and,
Yes.
you know, allowing ourselves, you know, greater options to have children maybe at a later stage.
So let's talk about your journey with IVF, Alice.
So my journey with IVF, I have had a lot of IVF.
Not with Billy.
No, with my third and fourth children. It is a really tough thing to go through, but I think the pain, so much joy is brought from it. And I
Yeah.
think that, you know, IVF is a solution that so many women didn't have, even if your generation.
Oh no, yeah, I don't know anyone that had IVF of my generation. But you deal with it very well, Alice. You're very brave. You're very practical. You're very disciplined, as we know from many past episodes, and you look at it as a journey that is just something that has to be done. Whether it's injections, and I mean, I think perhaps you don't remember. You were a tiny bit, Tom. Back me up here, emotional during it, and that would only be normal. But
No comment.
no comment. But you know, everyone is. But you dealt with it incredibly well.
Yes, but I was very lucky. And every
Yeah.
time I was going through IVF, I had 2 children or 3 children. So, you know, it was a greedy thing to do. But I think that for me, the excitement of IVF is not just perhaps helping fertility issues, but really the precursor to the problem with one's ovarian reserve fading as you get
Yeah.
older. And I'm, you know, these are just my views. And again, I am no expert, but I'm a baby pusher.
She is.
So
She is.
I'm just very, very pro having egg retrievals, which is now a new phenomenon really of our generation. And particularly in the UK. In the US, I was having a lot of IVF for Margot. It was much more common. Be having retrievals
Yeah.
as a kind of as a backup. And I would always be sitting a lot of the time in waiting rooms, and there was a woman quite a lot older than me. And I remember thinking, wow, God, you know, things are getting, you know, wow. And actually, it was mothers in there with their daughters. And I just think that it does empower you to, as I say, have a backup, have a plan.
Gives you time.
It gives you time. But it is expensive. But I've looked up a lot of, you know, treatments now and clinics you can go to, and it has become a little bit more accessible.
Has it?
And I think that it is a way that you can pick and choose what you want to do. It used to be just absolutely a no-go area
Right.
in terms of payment, but clinics are open longer, which I think is a huge thing.
Mm-hmm.
You know, when I was doing IVF with Felix, clinics would close at 4 and
So
open
if
at
you
10.
had a job, it was very difficult.
But also just checking your fertility levels as a girl, as a woman, checking your AMH, checking your FSH.
How do you do that?
You can get packs sent to you. It is not expensive. There's some for kind of £29, and they check these levels, and so you can.
And you can track it. So you can
Yeah.
say, well, I'm 32 and my level's this, and then they go down. And
because your egg reserve can just suddenly go down.
Can
And
it? Drops.
Yes,
Okay.
it can suddenly drop, and it can drop. You think it drops at 37, but actually it drops at 34. Or one ovary can, I don't, as I say, I'm not a doctor, but can perform less well than another. You can imagine being married to me. Tom loves all my fertility chat, but you know, I am a frustrated fertility doctor.
I know,
I would
I
love to open a clinic and. Anyway, sorry, Tom's looking at me like I'm over talking my time.
Not at all, not at all. Well, I was just going to say the moment or meltdown of the week has come.
Mum?
Well, my moment was very superficial, and it really I shouldn't really be talking about it because we're on a more serious topic. But I had been tracking these Jimmy Choo shoes for a while on my Teresa, and they came in with an extra 30% off, and I ordered them. And I haven't been home to see them, but I will. They've been delivered.
That is a great moment. It
It
really
was.
it
It makes me
also-
happy. I'm like, oh, I really wanted those. No, I'm not going to buy them. That's ridiculous. I'm not going to. Oh, yes, I am. 20% off with another 30% off.
It also lightens the mood when
Yeah.
we're like
What can I
knee
say?
deep. We're knee deep
in IVF
in
and
IVF.
FSH and AM, whatever levels. Yeah, it does. And what about you?
I can't remember a moment, but a meltdown was getting Margot up in the morning with my new puppy Betsy, and Betsy literally jumped onto Margot's huge polar bear in her room and peed all over the white
How
polar
could
bear.
something as sweet as that do that?
How could you do that?
And what breed of dog is Betsy?
You're
for
just
those-
trying to not talk about fertility.
No, I love
You see,
talking about
it's
it.
an
It's
age
clearly
thing.
not that relevant to me. But I mean, it is relevant. But I'm not going to have a baby anytime
Would
soon.
you have a baby for me?
No. Because you'd be so difficult about how much weight I'd put on or what I was eating and drinking, and you'd be like oh no.
Would you
no,
have
no.
a baby for any of your children if you were still fertile and it was their egg?
I think not. I've thought about that. I mean, I think it's very complicated.
I would.
I think. Okay. Anyone got a pen and paper?
I like genuinely would. Weirdly, as long as it wasn't my egg. If it was their
If
egg,
you were completely an oven, if you were a vessel.
if you were
yeah.
in an oven, like how
Yeah.
sweet. And then you're not really, you're like the best grandmother of all time.
Yeah, you'd be a fat one, but yeah.
Mum, that is definitely going to have to be cut.
Well, I would be. Have you had any miscarriages?
I've had 3. Yes, I've had quite a few.
I think a miscarriage, actually, I think at any time, I think it is always a loss and should never be underestimated.
Yeah.
And I think that's very important. I think people can say things about fertility that are you can see very hurtful. Like, oh, don't worry, it wasn't meant to be. Or it will be all right next time. I think it's very difficult, and people only mean well. They really only mean well. But I think people can end up saying the wrong thing when they meant the right thing. Yeah. But I think a miscarriage at any stage is a loss and something to.
And until you've gone through it, actually, sometimes it is quite hard to understand it. But I do think one thing that helps with miscarriages, which is what's so crazy, is, there is this big thing that you don't tell people you're pregnant until 3 months. But the problem is, if you don't tell people and you have a miscarriage, let's say just before 3 months, so many of the people you need to support you don't know.
Exactly.
So it is quite
No,
hard.
it's very difficult.
I
It's
always
very
actually
difficult.
tell friends when who are pregnant, tell the people you'd want to know if you had a miscarriage, because you do
very
need
good
that
advice.
support.
Yeah, I agree.
But no, I'm going through at the moment, a friend of mine is pregnant with a sperm donor and she's 43.
I know.
It is crazy, because had she not retrieved her eggs at 35, that wouldn't have happened. And I think those are the kind of examples of why fertility has changed in our generation, and what opportunities it can give us. So,
And I think, having been part of your IVF journey and our friends' IVF journey, I was there for the implantation of that embryo, which was truly magical. It really was. It really was very special.
And I think that's the other thing about IVF. I think a lot of my friends are kind of like, it's not as romantic and it's clinical and it's this and that. Of course it's not as romantic. But I think, again, because IVF has become more accepted, they do make a bigger deal of the implantation. They do, you get photos of the moment of implantation.
You get a video.
You get a video. Yeah, even in my day, how many years ago, I didn't get a video. But I know we're going to come across as real kind of IVF baby pushers, but it's only, just to experience, I suppose, being a mother. That's why we're doing this podcast.
Because we love mothering.
Is our greatest joy. And so to share that joy is key to me. And I think that knowledge is key. That for me is a big understanding of your levels. And if you have a level that's going down, go and try and prevent that from happening.
I think that's absolutely right. So are we going to touch on Margot and her journey?
Yeah, my 4th child was born by surrogate. And
which is quite unusual in England.
It is unusual. And I, had really tried myself to carry her, but after all the cesareans, sadly I couldn't. But I was just being unbelievably greedy, because I had these 3 healthy, wonderful children. And that was a battle that I really struggled with in my head, because I was like, Alice, just stop. Someone's telling you up there that whether you believe in someone or not, that you can't have any more children. But a very good friend of mine, actually called Ali, said to me, you know, Alice, you could have 6 children, and that yearning is an unstoppable addiction almost, like until you know you're done.
Yeah.
And so we did go down the route of surrogacy, which we didn't do in this country because it's a less complicated process doing it abroad. And we had a wonderful support team and wonderful people who brought Margot here. It wasn't easy, but it was, you know,
and we are forever grateful to her and
And
the
it's
team
becoming
who
more-
surrounded her.
yeah, and it's becoming more common
yeah,
as
yeah.
well.
And it was a journey. It was long. There were some nail biting moments. It's a long process in choosing the right surrogate. It's not easy, I would say. I know we look back at it because we have Margot and she is wonderful, but it is a long journey and not something to take on lightly. But if you go down the proper channels and are supported by the right team, it was wonderful. We were both there at the birth.
The main advice I would say is you just have to go in and not think about it. And I know that's
And you were very, very
crazy-
good at that. I think Tom and I thought about it too much or thought about it more.
You know,
and
a
you
horse,
didn't.
when they wear those blinkers,
Yeah,
so they're not
you
allowed
did.
to see.
Yeah.
Genuinely, that's what I just thought about for the whole 9 months. And you just have to be like, I'm doing this. Nothing I can do, nothing I can think about. You just have to have blind faith.
You did. You sent her all the vitamins, prenatal vitamins.
Yeah, I
You
think
were
you've just
incredibly thoughtful, but you didn't.
you just got to
didn't
keep
go down that rabbit hole, which you could so. Tom and I had a few trips down there, but you
don't
didn't.
go into
and
any
that was-
holes, and don't overthink it. If you want to do it and you feel you can do it, and you can do it, do it. I
And the
remember
birth
someone
was
saying
incredible.
to me to go into therapy before having a surrogate, and I thought, just going to overthink this whole thing.
No, you definitely didn't.
So yeah, you know, Margot's nearly 2 now, and in this similar way, you look back on her journey, not like a bad birth because it was a brilliant birth, but it is a little bit of a haze, a bit like one's own births. You know, it's a kind of memory, and it will always be there, but it is extraordinary what nature can do. And I will never forget putting her on my chest, half naked, not fully naked, and feeling immediately bonded within a millisecond.
Because just to be clear, she was your full embryo.
She
Yours
was
and
our
Tom's.
she was
Yeah.
our full embryo.
Yeah.
And I remember my sister, you know, I do find the kind of almost aftermath of surrogacy an easier topic to talk about, and actually one people don't talk about as much, is that my sister very sweetly flew out to LA to see us, or flew out to America to see us and meet Margot. And she was like 4 days old. And B said to me, you know, Alice, do you feel bonded? And I was like, B, I feel more bonded to this 4-day-old baby because I was well.
Yeah. Yeah.
I was
You were a
so
completely
well.
different person.
But like anyone is. And I
Yeah.
think that is like almost a sadness to biology, in that you do feel awful. And I suppose if you had these terrible births with complications and C-sections, you're just not lucid. But it is such a blessing when you can lift a baby up, when you can walk around and you haven't torn yourself, and you haven't got a huge gash. And so the bond was so unbelievably immediate. And I find that really huge gratitude to kind of nature that was. But you know, she's a joy, and they're all besotted by her, all the siblings, and it doesn't feel any different.
No, it doesn't feel any different at all.
But I agree, it was a big thing to do, and I think it was an even bigger thing to do because people don't do it over here.
No, it's much.
But I
more
couldn't
unusual.
recommend it more.
Yep.
And I've spoken to so many people who want to do it, and I would say in 20 years' time, over here it will definitely be 10 years even, you know, a more common thing to do. If you're mad and greedy like me, I know I'm not having any more.
No, well, you're done.
I'm done.
You're done.
Are you done? Did you want more after 4?
I did, fun enough.
yes, you
Funnily enough, I did, but I had my tubes tied.
What?
Glad it's great to have Mum on this because she adds a good of light.
that
No,
a
but
medical
it is.
term?
Yeah, you have your fallopian tubes tied, so you don't get pregnant. And then having had it done a year later, I said, "Oh, I think I've made a anyway. It's irreversible."
So like tying your
It's
shoelaces.
irreversible.
Yeah,
Wow, it's like having a vasectomy, I think, Tom. It's like
Yeah,
a female.
It's a female.
what?
Yeah.
I don't really want to know why you had your tubes tied, but anyway, well done you.
Well,
I do remember you getting pregnant with the last child, though.
Yeah, no, I just get pregnant
You
very easily, and so
you
I just
screamed.
Anyway, I did that. So,
But sorry, once you tied your shoelaces up, you can undo them.
well, not these shoelaces. No,
Okay, sorry,
not
just to
Tom.
be
Not
clear.
these shoelaces.
So I should probably stay out of this
I think
conversation.
maybe you can do something. Maybe you could try very, very hard to untie the shoelaces, but I'm not sure. And once again, we're not medically trained,
We are not medically
to
trained.
be clear. But I think your big message here is please check.
Check your levels.
Yeah.
Check your FSH. Check your AMH. I'm not saying retrieve your eggs, but if you are in your mid-30s and you're at a place in your life when you don't know if you're going to have a baby with the person you're with, or you aren't with anyone and you just want to have a backup for the future,
Yeah.
I believe it's the best money that you can spend.
Yeah, this will probably get cut, but don't choose the wrong partner.
That's a whole other conversation.
No, but I mean, don't be pushed into something because I'm this age. Just
Oh,
keep,
yeah, just having
have
a baby
handle on
because,
where your
yeah.
levels are, and so you know.
But people don't even know about their levels.
I know.
And
I know.
people, and then
I know.
they, and I will say one thing is that rather than having then 3 rounds of IVF when you're 37, you're going to have less eggs. If you do 1 round of IVF, again, I'm so sorry, I'm not a doctor, but you'll have more eggs the younger you are. So you can do it once and get 14, but you might have to do it 3 times and get 14 when you're 37.
Exactly.
My journey was a walk in the park compared to
So many people
so
have horrendous
many people.
times.
And actually, I feel I hate the word grateful, but the journey made the kind of result even more delicious and even more, I feel much more grateful that we had to work a bit harder, for some of them. But anyway,
There you
get your
have it.
eggs, get your eggs tested, get your hormone levels tested, and sad to hear Mum won't carry another baby for me.
Or anyone.
I have a question here that I was, Betsy, I was interested by are there any supplements you can take? And I have absolutely no idea about this, but I would say that Zeta West
In London.
She's in London, but she makes a whole like pre-implantation set.
Yeah.
She makes a freezing your eggs pack. She makes a whole tailored thing. Now, experts will say they don't do anything.
Well, we don't know
Again,
that. You don't know that.
I'm
I
no
don't know that.
expert, but I will say that for the final 4 years I had IVF, my levels stayed the same, and I retrieved the same amount of eggs, and I was always on that Zeta West. And
I think she does something for menopause as well, but that's a whole other
Jesus,
subject.
like,
And
I'm
you know
still
what?
in my
I'm not
30s.
going to do
Is
it.
that the menopause episode?
No,
coming
we
up?
should
You
do
know
it
what?
with
We're
Mum.
not doing
Yes,
it. I mean,
Serena.
I've been a bit of a sort of, what's the word, passenger on the fertility thing, because obviously it doesn't affect me now. But I will not be doing
You'll be
menopause.
driving the menopause episode.
Okay,
No,
well
not
then,
doing one.
we'll have
You're
to
in the
go back
driving
to
seat.
vibrators.
Oh
But
my God.
I'll tell you the best bit of fertility advice again that I was ever given was by
gonna be rich.
Dr. Marie Wren, who I don't think will mind being name checked, and she was really, in my opinion, the best, the sweetest woman. And
She was.
I walked in, and my husband said, My wife just doesn't relax. She goes on holiday and she writes lists, and she just doesn't sit still, and that's why she's not pregnant. And Marie Wren said that is probably her relaxation. And it was so cool that she basically said, look, to one person, relaxing is lying in bed.
Well-
And this idea that to get pregnant you need to be zen, you need to be this. That is what I don't agree with. And
No,
I think
that's
the
a very annoying
pressure, it's a
statement.
very annoying, and also the pressure of trying to feel relaxed.
Well, never in the history of telling someone to relax have they relaxed.
Yeah. Also, never in the history of telling someone to relax has that got them pregnant.
So I think
Because
that's the end
but
of
it's
this
just
episode.
it's just coincidence if you suddenly were relaxed. But anyway,
Do you remember being relaxed recently?
I'm
just
relaxed.
fine.
I'm super relaxed right now, telling quite a lot of people about my fertility
Are
journey.
you? Good.
I'm feeling really like in my comfort
In your zone.
Yeah.
Should we go to question o'clock?
Let's
Oh,
go to
yes,
question
please.
o'clock.
Okay, first from Janet. Is there an affordable way to go through fertility?
Well, I think that the point is it is expensive, and I think that you have to have a lot of failed attempts and miscarriages, sadly, to have IVF on the NHS.
In England.
But I did do a little bit of research on, and there is now this kind fertility around, which
Is that in England?
that's in England. They have 17 clinics, and so that is a really good,
But you pay for it.
a good site. You pay for it,
Right.
but their message is for it to be affordable. So I definitely look
Okay.
into that. It's called Kind Fertility.
And now from Maddie, are there any lifestyle changes or supplements recommended to improve results?
I think, again, it's that fabulous Zeta West. But lifestyle changes,
No drugs.
no drugs.
Don't drink.
No, but
Don't
you know
smoke.
what? You know what? This question, again, it's probably a really annoying answer. But lifestyle changes to get pregnant, I just think
Yeah,
it
I think
gets
don't-
it muddies your brain.
Yeah, people
just
overthink
be
it.
you, of course.
Yeah,
like,
but obviously
don't drink loads of vodka but some of
any
my best
vodka.
friends got pregnant on vodka.
Yeah.
And actually with really low AMH levels.
Alice, I'm no expert, but I don't think you should be suggesting to people to drink like just a bit of vodka.
I
Like, I'd
just
say
think,
no vodka is
having
right.
been I've had 4 kids, 3 miscarriages. The amount of times people said lots of different things to me, lie on the bed, put your legs up, don't put your legs up, don't think about this, do this, sniff this, eat that. I just think what works for you is right, and I think you really can go down a rabbit hole of what you can
Absolutely.
do.
It must
I
send
do
you
think
more
putting your
crazy.
legs in the air is probably quite a good idea, though. Definitely didn't feel like cartwheeling out of the surgery.
No, you stayed there for a while.
Yeah, lie upside down if you can.
How do you lie upside down, Alice?
One of the beds in the New York clinic I went to, they tilted me upside down
Oh, I see.
after the
Fair enough.
transfer, then fainted after because my blood pressure was so low. That was a low moment. Oh, there's like so many low moments in
You can
in
get
all
those
this.
exercise clips that hang you upside down like a bat. Maybe anyway, that's probably unhelpful to say, but
But if any of this have been of any interest to you all, we could go deeper into it. We could go into pregnancy. We love that. This is just the beginning of the clinic Mum and I want to open. We want to do an IVF clinic, don't we?
We do.
We do.
What would we call it?
clinic
Everyone
for-
loves my grandmother.
I mean, you are
a
just
clinic run by what's the opposite of experts?
Half-wits. We could call it Come to the Half-Wit Clinic. Clearly,
Half-witted.
yes, I don't think we could do that without medical training or backing. But,
No, but we
it's
will.
an idea. It's an idea.
It is an idea. And we could have like a therapist there ready for things that...
That couldn't be you.
Wait,
Betsy would do a good
She
job.
is so mean to me.
But you're not a good therapist, Alice.
You are the worst. You are the absolute worst. If I fall over as a child, you'd be like, get back up. If I was
Yeah,
sad,
well,
you were like, go to a
what can
therapist.
I say? What can I say?
The apple doesn't fall far is all I can say. Anyway, we love each other really, and everyone does love my mother. So thank you for listening.
Yeah.
I
Bye, Mum.
hope there's been a tiny bit of a message here. We would love to answer any other questions. You can always DM us on Everyone Loves My Mother.
Mm-hmm.
My mother will be manning the inbox. But next week, we have got a bit of a lighter topic.
What's that?
Business.
Do I have to be on that?
Yes, you have to be on that. We're going to talk all things business. We hope that it is not just you, Pama, listening.
I'm not going to say bye for now. I think that's too corny. Bye. No, bye,
Bye
for now.
for now.
No.